Welcome to Module 2.8.3 of the Alberta Aids to Daily Living online training module for amplification benefits. This module will provide you with information about the role of Alberta Blue Cross and how to navigate the online portal with respect to amplification benefits. Prior to reviewing this module, it is recommended that you review AADL Module 1, the first two amplification benefit modules, the AADL General Policy and Procedures Manual, Manual H, and the approved product list. This section discusses the role of Alberta Blue Cross with the AADL program. This slide explains how the Amplification Benefits Program is split between AADL and Alberta Blue Cross. AADL is responsible for determining benefit eligibility criteria, funding levels, policy direction, governance, and product selection. AADL continues to review exception requests, QFRs, and appeals. Alberta Blue Cross provides administrative support by registering providers and processing authorizations and claims. New vendors must sign agreements with AADL and Alberta Blue Cross if they wish to provide amplification benefits. AADL authorizations and claims are processed through Alberta Blue Cross. AADL providers have their own link on the Alberta Blue Cross online portal. This section discusses how to register with Alberta Blue Cross as a provider and specialty assessor. AADL providers must register with Alberta Blue Cross using the online form. If you have more than one office, a separate request form must be completed for each office. For offices with more than one health services provider, each person who bills under their own practice should complete a separate form. New vendors or specialty suppliers will be reviewed by Alberta Blue Cross and Alberta Aids to Daily Living to determine if they meet the criteria required to provide AADL services. A provider can be provisioned with one of three roles on the Alberta Blue Cross portal. Registration as an authorization submitter gives the provider access to submit authorization requests and view authorization history. An authorization submitter will also have access to the patient inquiry screen. Registration as a claim submitter gives the provider access to submit claims and view both authorization and claim history. Registration as an authorization and claim submitter gives the provider access to submit authorization requests as well as claims and view both authorization and claim history. An authorization and claims submitter will also have access to the patient inquiry screen. All providers need to be registered on the provider portal to submit authorization requests and/or claims. New providers will need to provide all required AADL policy documents to Alberta Blue Cross. Alberta Blue Cross will then work with AADL to validate the provider and, if approved, register them on the portal with the appropriate specialty. Once a provider exists on the provider portal, practitioners can be added to that provider. The practitioner is the individual working for the provider who is submitting the authorization request or providing the product or service for a claim. Individual practitioners will be able to request access to the website via the online registration form. New clinicians will need to be added to a clinic's account. The submission will be reviewed by Alberta Blue Cross to determine that the clinician meets the AADL registration requirements outlined in the Amplification Benefits Manual. Alberta Blue Cross has several training resources and videos specific to their website. Examples include, but are not limited to, how to submit authorizations and claims, how to access reports, tutorial videos, and contact information. AADL manuals and forms are available on both the AADL and Alberta Blue Cross websites. Please ensure you are familiar with these resources. Once you have registered through the Alberta Blue Cross portal, you will be able to complete patient inquiries, create authorizations, and/or submit claims, depending on the type of access you chose when you registered. This section will discuss how to make a patient inquiry. The purpose of the patient inquiry screen is to present enough information to a provider so they can determine whether the patient is eligible for a specific product or service and continue with an authorization request submission. The patient inquiry screen will also allow a provider to update a patient's address information. The provider will need to enter the personal healthcare number and date of birth of the patient to begin a patient inquiry. If a match is found, the designated categories will be populated with that patient's data. Patient information includes the patient's name, personal healthcare number, date of birth, age category, address, phone number, and residency code. The age category of the patient is based on patient age or the family senior status. Possible values include pediatrics 0 to 17 years, student 18 to 24 years with a student enrollment letter on file and confirmed dependent status, adult 18 to 64 years, confirmed senior 65 plus, or a spouse adult dependent of a confirmed senior. Spouses and adult dependents of a confirmed senior may be under the age of 65. The status category displays the patient's current AADL status, which indicates whether they are eligible for AADL benefits. There are 3 status options: active, inactive, and coverage ended. Active means the patient has an active Alberta healthcare number and would be eligible for AADL benefits if eligible. Inactive means the patient has an inactive Alberta healthcare number. Therefore, the patient is not eligible for AADL benefits. Coverage ended means the patient is terminated on the Alberta Healthcare Insurance Plan file. The termination date of the patient's last active Alberta Healthcare registration number will be displayed in the coverage end date field. If coverage is inactive or ended, the client is not eligible for AADL benefits. The client must contact the Alberta Healthcare Insurance Plan, not AADL, to have their healthcare number reactivated. In the above example, the client is a confirmed senior and has an active healthcare number. Therefore, they are eligible for AADL benefits if they meet the eligibility criteria for the benefit they are applying for. The AADL cost share status category displays the patient's cost share status for the previous, current, and future benefit years. There are 3 possible cost share status types that can be displayed for a patient: cost share exempt, and cost share reached. Cost share means the patient pays cost share and has a family pay code of 21. Cost share exempt means the patient is exempt from paying cost share for the benefit year and has a family pay code of 6 or 23. Cost share reached means the maximum $500 cost share portion has been paid by the family, so the patient no longer has to pay cost share fees. The family pay code for the patient is 22. Cost share reached does not mean a client is cost share exempt. Patients with extended seniors hearing aid coverage status are automatically exempt from paying cost share for hearing aid benefits under the audiology program. They are eligible for 2 hearing aids. The extended seniors hearing aid coverage status for a patient will be displayed in the extended seniors hearing aid coverage category and display the effective period of the status for the previous and current benefit years. Effective date is the effective date of the extended seniors hearing aid coverage status for the benefit period. If the patient does not have an extended seniors hearing aid coverage status, the field will be left blank. Termination date is the end date of the extended seniors hearing aid coverage status for the benefit period. If the patient does not have extended seniors hearing aid coverage status, the field will be left blank. The maximum hearing aids funded category displays the maximum number of hearing aids the patient is eligible for under the hearing aid benefit. Possible values include 0, 1, or 2. The eligible quantity is determined by the patient's cost share status, AADL status, age category, and extended seniors hearing aid coverage status. The eligible quantity does not consider any hearing aids that have been purchased privately or adopted by the patient. The product consumption category displays information about any products or services that have been purchased or provided in a set time period that share frequency maximums with a specified product. The following product consumption fields will be displayed: benefit type, and product. The benefit and product fields include the product or service that is being searched for. Values include the various styles of hearing aids, personal listening devices, FM systems, cochlear implants, bone-anchored hearing devices, and ear molds, fitting fees, manufacturer and in-house repairs and service fees, and hearing aid return fees. In this example, the client is cost share. He does not have extended seniors hearing aid coverage because there is no expiry date listed under the extended seniors hearing aid coverage heading. He is eligible for a new hearing aid because no records have been found for the past 5 years. If the client had received benefits in the past 5 years, the patient inquiry screen would also include information regarding the anniversary service dated, body side, and quantity. Anniversary service is the date of service for the product purchased or service provided within the provider's specified product's benefit period. Body side is the body side the purchased product or provided service was for. Possible values include right, left, or unknown. Quantity is the total number of products or services that belong to the provider's specified products group that have been consumed within the group's benefit period. In this example, the client is cost share exempt with extended seniors hearing aid coverage. We know he has extended seniors hearing aid coverage because there is an expiry date. This client is eligible for 2 aids. However, the product consumption shows that this client purchased aids in November 2017. Therefore, they are not eligible for new aids because it is not 5 years since the anniversary date. If the client had not purchased hearing aids in the past 5 years, the message would state, "No records found." Some examples may show that the client is cost share. However, if they have extended seniors hearing aid coverage, this means they're eligible for cost share exemption for hearing aids, but not other benefits. This section will discuss how to create an authorization. Funding applications for amplification devices are submitted to AADL through the authorization process on the Blue Cross Health Portal. Follow the directions to enter patient information, and then select the specific items being authorized from the relevant drop-down boxes. Please review the ABC resources on how to create an authorization. The following documents must be submitted for amplification benefit authorizations: a signed client consent form, a diagnostic audiogram completed within the past 6 months, confirmation of enrollment for full-time dependent students if applicable. If the authorization requires further analysis, the details of the authorization will be sent to an Alberta Blue Cross coordinator for further review, and the status will remain in a pending state until an approved or declined status is determined. Once a decision has been determined, the Alberta Blue Cross coordinator updates the authorization status, which can then be viewed by the provider on the provider portal. If the authorization does not require Alberta Blue Cross coordinator intervention, the system will process the authorization and immediately display the adjudication results on the provider portal. Alberta Blue Cross will provide a confirmation of the authorization with reference numbers for each authorization. The following devices require an authorization for purchase: a hearing aid, FM device, personal listening device, bone-anchored hearing device, bone-anchored hearing device with soft band, and cochlear implants. Bone-anchored hearing devices and cochlear implants are the only devices that require an authorization for a repair. All other amplification devices are adjudicated at claim submission. If a claim is submitted prior to an anniversary date, it will be rejected. Devices may be adopted if they were not purchased through the AADL program. This would apply to aids that were purchased privately or when a client was not eligible for AADL benefits. If a client becomes eligible for AADL benefits, providers can complete an adopt authorization. This registers the device with AADL in order to access funding for repairs and associated products and fees. QFR requests must meet the criteria outlined in the AADL General Policies and Procedures Manual and the Amplification Benefits Manual. If all criteria are met, the provider can submit a QFR request. Please note, lost hearing aids are not a QFR request. AADL does not replace lost hearing aids. Clients are expected to obtain insurance on devices after manufacturer warranty expires and should be counseled to this effect. A QFR is not an actual authorization, but is collected under the authorization submission process on the provider portal. The provider begins the QFR process by entering the details of the QFR request on the provider portal. The provider must upload supporting documentation and submit the QFR request. The QFR authorization is then created and pended for further review. Alberta Blue Cross will send the QFR request to AADL for review. The QFR status will remain in a pended state until an approved or declined status is determined. After the review has been completed, AADL will communicate the decision to Alberta Blue Cross along with notes regarding the decision. The QFR status will be updated on Alberta Blue Cross's system, which can then be viewed by the provider on the provider portal. A notification that a decision has been made for the QFR will also be sent to the client and provider from Alberta Blue Cross. If the QFR is approved, Alberta Blue Cross will update the system with the approved frequencies and quantities for the specified products and create an authorization for the requested benefit. The following section discusses how to create a claim. After an authorization has been approved, a claim may be submitted. Please review the ABC resources on how to submit claims. To submit a claim, the provider enters the details of the claim in the provider portal. The data is validated to ensure correctness. If the data is valid, the provider continues the process by requesting a predetermination. The claim is then processed and the results of the predetermination are displayed, including eligible amounts covered by the AADL program and cost share amounts to be paid by the patient. The provider then has the following three options: process the claim using the original claim details, modify the original claim details and predetermine the claim results based on the modified claim details, or cancel the claim. If the provider chooses to process the claim based on the predetermination results, the claim is created and the results are immediately displayed on a claim statement. If further analysis is required to determine the results of the claim, it will pend until a review is completed by an Alberta Blue Cross coordinator and the results are updated. Only processed claims that are pended will be reviewed. Predeterminations are not fully processed claims and do not fall under this process. Here is an example of a claim printout for a cost share client that purchased one hearing aid that cost more than $1,200. As you can see, AADL pays $900 towards the aid, and the client is responsible for the remainder. Here is an example of a claim printout for a cost share client that purchased one hearing aid that cost less than $1,200. Because the aid is less than $1,200, AADL pays 75% of the $1,000, which amounts to $750. The client pays the remaining 25%, which amounts to $250. In the above example, the client purchased one hearing aid that cost more than $1,200. The client received a wheelchair within the same benefit year. As a result, the client has reached the maximum $500 they are required to pay. In this scenario, AADL pays the maximum of $1,200 towards the hearing aid because the client's cost share has been reached. The client is still responsible for the remaining $200 upgrade cost. As stated earlier, reaching the cost share contribution does not make the client cost share exempt. They are just not required to pay the cost share portion after the $500 limit has been reached. In this example, the pediatric client purchased two hearing aids that cost more than $650, two ear molds, and an FM system that cost more than $1,900. As a result, the client reached the maximum $500 contribution they are required to pay, so AADL pays the remainder of the cost share portion. The client is still responsible for upgrade costs. Please note that the fitting fees have not been included in this example. Typically, there would also be hearing aid fitting fees and FM fitting fees included in a pediatric fitting. In this module, we discussed the role of Alberta Blue Cross within the AADL program, how to register as a provider, and how to navigate the Alberta Blue Cross online portal. The final module provides you with important AADL and Alberta Blue Cross contact information and links as they pertain to the amplification benefits area. You may want to print it off for quick reference. Thank you for completing the amplification benefit modules. If you have further questions, please contact the AADL Program Manager or Alberta Blue Cross Client Services.